Hey now, Peter Hartman here, saying welcome down to fix your old back. Some mornings you might wake up, get a kink in your neck. You're working, you go like this, and you get that nice sharp pain, and oh, now what do I do? Well, I'm telling you, what you do is you have patience. First of all, stop what you're doing, at least relatively soon, and you need to pull gently on the vertebra so that the muscle will loosen up. Gentle is really important. You want to keep the neck so it feels safe. You want the muscles and bones to be in a safe position. So if you're over here saying, oh man, do I want that thing to stretch, you see, my neck is really not very comfortable right here. That's why we use a pin and stretch technique. So I'm looking to work on this muscle, give you the side view here. And if I was stretching it, I'd be way over here, but if I pin it and then stretch, I am right about straight up and down. Okay, I give you the front view. I'm pinning. I'm getting a nice stretch, and it's right there where my bones feel comfortable. The muscle feels a little bit uncomfortable because I'm pinning pretty hard. Show you my pinning technique, one finger over the other, so that I can push without hurting my fingers. Now this pin and stretch happens for 2 seconds, and then I relax back to neutral. 2 seconds, 2 seconds. It goes on for 20 repetitions. You usually feel a significant change after about 10 repetitions, but keep on going. So what this is doing is increasing the length of the muscle, in other words, stretching. You're also increasing the blood flow because you're moving. Right? You're pumping short, long, and you're also educating this muscle. You're saying, hey, we go from short to long to short to long. Every time you move, you're getting smarter. Your muscles are talking to each other. They're figuring out how to work together. Now, if I just sat and did this, yeah, I'm getting the muscle longer, but I'm decreasing the amount of blood that's getting to that muscle because I'm just holding it tight. Within about 5 seconds, there's less blood in that muscle than when I started, and it's not learning anything. So yeah, it's getting longer, but then when I bring it back here, it's like, oh yeah, we remember short, we know how to do that one, because it didn't have a chance to learn long, short, long, short. So let's go back to the pin and stretch. So here I can use these fingers, or I can use these fingers. Oh man, that works good. And one of the real big advantages of a repeated stretch, this 2 second repeated, I can be thinking about something else while I'm doing it, and I keep doing it. I could walk across the room, I could be talking to somebody, and yeah, it looks a little funny, but it's not looking that bad, and it sure doesn't look like, oh man, he looks like his neck really hurts, I don't want to talk to that guy. Now, we got it, and you're comfortable, people around you are comfortable, and you're getting a nice stretch. Now you can see I'm pinning over in this direction. I'm not pinning here, okay? This at the at all these veins, arteries, nerves in here make you want to throw up. Don't do that. Let's go over here. Now in some cases I'll be working up the neck. That's where I started. So using this hand, I need to kind of work up the neck. I'm not here where it hurts, I'm not in the front where it hurts. But it can be a lot more comfortable here because this arm is nice and relaxed. Now, you've got a lot of neck muscles, lots of choices here. You've got this SCM right here. That would be done by grabbing, raising up. You don't have to memorize all these positions. One of the great things about this technique is you feel it, you got it. If you're not feeling it, you don't got it. So, SCM there, sternocleidomastoid, otherwise known as the scared actress muscle. Oh, sorry. Next to that, you've got the anterior scalene. It's a little deeper. It's right behind the clavicle. Again, don't push here. Pinning right here. Oh yeah, and you can see I'm lifting my chin a little bit, turning a little bit. Mostly it's a chin lift. Move over to the next one, the middle scalene. It's much more bringing the ear towards the opposite shoulder. A little bit with the turn, but you know, mostly it's the ear to the shoulder. That's finally really given way there nicely. Moving on back to the posterior scalene. Now this is getting a little uncomfortable for me to pin by using this right hand on the left side, so I'm going to use the left thumb. Now, you can see I'm not going down this way. I'm really working back and at an angle. Let's give you another view on that. Right, I'm going in like this. Now if I peg right there, I've got the posterior scalene. If I move just a little bit further back, I've got levator scapula, which most people call the upper traps. The upper traps are actually here on the surface. Now I'm going underneath the upper trap, scooting back under that shroud of the upper trap, and there we go. Now you can see with the levator scapula, I'm going over this way. So I'm looking down and to the right about 45 degrees. Now this is your classic muscle for being tight from doing this, like office workers, driving, lots and lots of things. You know, everybody's like, oh, those upper traps. You know, this is a really important muscle. Almost everybody needs this almost every day. When I'm hitting this and it's really tight, I'll often feel it up here or pulling up this way. Don't overdo it, but it's normal to feel some referred pain when it needs it. There we go. Now let me turn all the way around here. You can see my hand is clasping around the back of the neck. It's just to make it a little easier. You can see my elbows up pretty high. I'm not like this. That just makes it harder. This way, the weight of my arm pulling right down into that levator scapula. That way I can largely relax while I'm doing this. I got a good release out of that one. So just going straight for levator scapula here. So with this technique, you are getting the muscles to loosen up, retraining them, getting blood flow into them, you know, all the good stuff. You really can take your time. It only takes about a minute for each muscle, and you don't have to get them all. You'll figure out which ones are the worst. Now, these for right-handed people, and really a lot of left-handed people. Mouse shoulder. These get tight more in the back, levator scapula. Though sometimes these here, like if I lift this way, it's coming through the pecs, up through the anterior scalene. And so that comes to the side of the neck and often torquing on that vertebra. So one way to undo that is to simply torque it back. This is called the snag technique.